Hey guys, in this video we will going to discuss the Norma Basalis middle part. So the middle part of the Norma Basalis is formed from the anterior half and the posterior half. The anterior half is formed from the vomer and the sphenoid bone, while the posterior half is formed from the occipital bone and laterally from the temporal bone. While that of the anterior part we have discussed in the separate videos formed from the teeth and the hard palate. Now the middle part of the Norma Basalis. The middle part has the anterior half and the posterior half. The anterior half is made up of two bones, that is the vomer and the sphenoid. The vomer is a bone that is forming the medial nasal septum. You can see here this is the vomer that is forming the nasal septum and dividing the two corni of the nasal cavity for the passage of the nasal air or the vessels that are going through the nose. The vomer has a short bone, so it has only a function of forming the nasal septum. The other bone present in the middle part of the Norma Basalis is the sphenoid bone. The sphenoid is a large wing-shaped complex bone and it has the body. This is the body of a sphenoid, and these are the pterygoid process of the sphenoid that are coming from the body and forming the pterygoid process. The pterygoid process has the medial plate or the lateral process or lateral plate of the pterygoid process. Plus, the pterygoid process also has a scaphoid fossa in between the two plates of the pterygoid process, and the sphenoid has a lesser wing and a greater wing. The greater wing you can see in the lateral view, where it is forming the norma lateralis and taking part in the formation of the norma lateralis. This is the greater wing of sphenoid that is suturing with the temporal and the zygomatic bone, while that of the lesser wing of sphenoid is not seen in the inferior view. So the sphenoid bone has some foramens and opening for the passage of nerve and vessels. There will be seen the three foramens in this video. The first you can see here, this is the foramen ovale. The foramen ovale is inferior to the pterygoid process of the sphenoid. This foramen ovale can give passage to the nerve and vessel. The mandibular nerve and the acetylpharyngeal artery pass through the foramen ovale. Inferior to the foramen ovale is a short foramen. This foramen is the foramen spinosum. The foramen spinosum gives vessels and arterial supply to the middle meningeal artery and the middle meningeal nerve and vein that are passing from the foramen spinosum. Medial to the foramen ovale and foramen spinosum is the foramen lacerum. The foramen lacerum is formed lateral to the body of the sphenoid, and the foramen lacerum provide a passage to the deep periosteal nerves, internal carotid artery, and the cartilage in the adult. The foramen lacerum is also present in the lateral to the body of the sphenoid. So these three foramens are present in the anterior half of the middle part of the Norma Basalis. Now we will coming to the posterior part of the middle part of the Norma Basalis. The posterior half of the middle part of the Norma Basalis have the two bones, that is the occipital bone and the laterally the temporal bone. The occipital bone is coming its way by the foramen magnum. This large the foramen magnum you can see here, that is giving passage to the medulla, meninges. The spinal cord is passing through the foramen magnum. The cranial nerve and spinal arteries may pass through the foramen magnum. This is the most largest part that is seen in the Norma Basalis. So the anterior to the foramen magnum, this is the occipital, this is the basilar part of the occipital bone, and that is articulating with the temporal bone, and there will be a presence of number of foramens also that are present in the Norma Basalis posterior part. These are the, so this is the carotid canal. This is present in the posterior half of the middle part of the Norma Basalis. The carotid canal gives the vessels or supply to the carotid artery and the carotid nerve that is passing from the carotid canal that is present behind the foramen ovale or the foramen spinosum. Inferior to the carotid canal is the presence of a large notch-like foramen. This is the jugular foramen or the jugular notch. You can see here this hole is the jugular foramen, and through the jugular foramen various nerve and arteries are passed that are internal jugular veins, cranial nerve, and the arteries of the spinal cord are passed from the jugular foramen. This hole is the jugular foramen. Now, posterior to the jugular foramen, there between the styloid process and the mastoid part of the temporal bone is a stylomastoid foramen. The stylomastoid foramen is giving a passage to the facial artery. From the stylomastoid foramen, the facial artery courses into the Norma Basalis. So, this is the foramen that is present behind the foramen carotid canal and the foramen lacerum. Now, middle to the foramen lacerum, there is another canal or another opening called as the hypoglossal canal. This area or depressed area is called as a hypoglossal canal through which the hypoglossal nerve can pass. Now, come to the posterior half of the Norma Basalis, which will be discussed in the next video.